Dr. Williams, I was hoping we could talk a little bit about the duration of treatment for medication-assisted treatment.
That's a great question because through our work around the country, I think we've seen with treatment providers that often there's this sense of urgency to get people off of medication as quickly as possible. Or this idea that, you might use buprenorphine to detoxify someone over the course of a few weeks, but you would never want someone to be on it long term. And the evidence suggests otherwise. The studies that have been coming out from the last 10 years in particular really show that the longer someone is on treatment, the better they do. The longer someone's on whatever MAT modality is working for them, the better their outcomes. There really is no evidence that shows that there are benefits to coming off of a MAT medication. So patients who are on methadone successfully for 6 months, they do great for 6 months. If you were to taper them off of methadone after 6 months, 60, 80, 90% relapse within the next year.
And that almost sounds in contradiction to kind of how the treatment field thinks about treating substance use disorders, that we really want to get our clients off medications as fast as possible, but it sounds like Matt is kind of saying the exact opposite.
Well, you're speaking to some of the stigma in the addiction treatment field around using medications. And I think it's changing, it's evolving, it's getting better every year, but there's still a lot of very strong and vocal sentiment that people can't be in recovery if they're on medication, or can't be in recovery if they're, you hear this phrase, substituting one addiction for another.
Right.
But that gets applied to any kind of medication. In the 90s, for instance, there was stigma against patients who were taking Prozac for depression. You have patients with suicidal depression, and they were judged for using an evidence-based treatment for a mood disorder. And we're still seeing that now in terms of prejudice against patients who are on methadone or taking buprenorphine or even on a monthly injection like Vivitrol. There's this idea that you can't be on medications and really be in recovery. And in part to respond to those concerns, basically all of our federal agencies, the CDC, the SAMHSA, the Substance Abuse and Mental Health Services Administration, the President's, the White House, the Office of National Drug Control Policy, all of the large federal agencies have been outspoken in underscoring what recovery really is in terms of the persistent, intentional abstinence from intoxication, from engagement in daily life, gaining employment, reestablishing family and social ties, being present in everyday life, being able to weather the challenges, the daily lows and highs of life without using something. And all of those things can be present. People can enter recovery even with MAT as part of their treatment. And if anything, we know that MAT modalities such as methadone, buprenorphine, or naltrexone actually help people stay in treatment early on in their recovery work. So patients who enter a drug treatment program, if they're on methadone, they're much more likely to be there 6 or 12 months later than patients who are in a recovery program with no methadone. Patients are given buprenorphine, they're much more likely to be retained in treatment, to have better treatment outcomes than people who aren't given buprenorphine. So there's a growing evidence base, which is part of why the president has made this such a priority in terms of expanding access to funding specifically for the medications in drug treatment programs, including drug treatment programs that have been historically hostile to using medications.
So MAT is really a support to recovery. It does not discount someone from being in recovery.
There's no reason for it to discount someone from being in recovery, especially if you focus on quality of life, level of functioning, the patient's ability to tolerate psychological distress without using substances to self-medicate themselves. There are a lot of ways to look at recovery that can greatly improve people's lives, where there's no contradiction in terms of the use of medications. The same way we wouldn't judge patients in any other field of medicine for using medications.
And so